So good evening all. I will be, after such a night's introduction, you must be now aware of what we are talking about, the smart screening. So my talk will be restricted to DR to HTR, that is diabetic retinopathy to hypertensive retinopathy, on-spot screening to tele referral for retinopathies. I will be showing some digital devices as a part of my presentation, but I have no financial interest to declare. So nowadays, non-communicable diseases like diabetes and hypertension are talk of the town and are health hazards or health epidemics of this 21st century globally. So why are we bothered about? Besides being life-threatening, they are sight-threatening also. These retinopathies can make a patient devoid of their sight. So DR, that is diabetic retinopathy, is a major cause of blindness in working middle-aged population and is the 5th cause of blindness globally. So statistically, to overview this data, from 2021, when the prevalence was 537 million, it's estimated to rise to 643 million in 2030, and in 2045, it's going to rise up to 783 millions. And our being a developing country, it has been said that 3 out of 4 adults with diabetes live in developing countries, that is low to middle income countries. So coming to our statistics, India accounts for 1 in 7 of 4 adults living with diabetes in the world. I am talking about diabetes, but diabetes and hypertension generally coexist. And in fact, hypertension is one of the risk factors for diabetes. So that's why we have taken both the retinopathies together. So 1 in 2 adults living with diabetes are undiagnosed. This is our problem. And soon, India will be going to the global capital of diabetes. So what is the solution? We have to, because diabetes and hypertensive retinopathy are preventable. How? If they are screened, diagnosed, and treated at time. So now the screening procedure should be affordable, accessible, and accurate also. So as our job, what we used to do, besides providing services in a tertiary eye care center, we frequently conduct camps at peripheral centers. And this is our team. We have a retina specialist with his helpers and nursing officers. And he is doing the most reliable and gold standard procedure for detection of diabetes. So is it cheap? Yes, the instrument is cheap, but we can afford retina specialist going to every peripheral centers. We don't have a retina specialist even at every tertiary center. So how can we afford retina specialist going, visiting each and every PHC or CHC? So this is the problem. Halanki, this is the gold standard procedure, doing indirect ophthalmoscopy and on-the-spot screening. But we have a shortage. 1 ophthalmologist per 1 lakh population. So this is not going to solve the burden of disease which I mentioned about. So what should we do? We have to engage our healthcare professionals to help us out, to fill this void. How is this possible? As Sir said, digital devices. So this is the most useful digital devices for capturing images of retina. This is called a fundus camera, and it has gone its under evolution being standard, wide field, or stereoscopic. And besides taking images, what other advantages do we get? It has helped us in documentation. It has helped us in counseling of the patient. The patient can see their images, and they will be more convinced. Monitoring of retinopathy. So it has been found to be very sensitive and specific also. So it has led to a development of another branch, that is teleophthalmology, where the pictures are captured by non-ophthalmologists and analyzed by ophthalmologists. So what are the barriers now? Ours is a rural-based country. Patients are ignorant, and it's not a point of time. Diabetes is a chronic disease, and we need regular, repeated screening. So there are some technical challenges also. Can you see the design of this fundus camera? It's not portable at all. We need to have some training of the staffs because it needs some alignment of the optics part. We need to have a constant electricity supply and an internet coverage for all of these. So again, these are, and this equipment is quite costly. Again, a cost factor, which is important for our setting. So we need to be a smart worker. Like this crow has smartly taken what it wants to, and this gentleman has added wheels to its burden. So what should we do? So there has been, as the needs develop, the development goes in that direction so as to overcome those barriers, and one of these is modifications of designs. To overcome these hefty designs, there has been modifications in the designs of fundus camera to make it portable. And there are various modalities available, and they differ in image quality, field of view, whether they require mydriasis or not, and the nature of images. And the development has went afar, and we have now get handheld fundus cameras also, and they have proven to be high sensitive and specific, and the sensitivity progressively increases as the disease increases from NPDR to PDR, very well serving our purpose. And there is provision of instantly uploading the images to cloud-based, very well serving the purpose of documentation also. So, and the recent addition into this series is a relatively new, useful clinical tool to image the fundus, that is smartphone-based fundus cameras. It has many more additional advantages, like it's portable, it's chargeable, it's inexpensive relatively, it's lightweight, it can be handled, it can be non-mydriatic or mydriatic, there is sufficient field of vision, there are autofocus feature of smartphone can be incorporated for getting high image quality. And the light source uses very low intensity as compared to the fundus cameras, which increases the compliance of the patients. So the advantages are manifold. So literally, it can be done by anyone. As Sir said, socially engaging. If we are lacking of health professional, we can even engage the community of persons to take pictures from this type of cameras. So it's very engaging, and it's relatively very easy to learn. So there are articles which supports its feasibility and clinical utility, and there has been studies to compare the image qualities with gold standard conventional tabletop fundus cameras, and it has been found to be highly sensitive and specific method of screening. Validations has also been done for the smartphone-based retinal photography. Now, what is the problem now? Again, image has to be analyzed by an ophthalmologist. So this is again the limiting factor in this technology. So it can result in delayed interpretation, delay in proceedings for the management of sight-threatening diabetic retinopathy. So here comes the role of artificial intelligence. Why are we supposed to be intelligent? Because we can analyze, think, categorize, and we can decide. So incorporating artificial intelligence is similar to training a computer to take decisions. How is this done? This is done by feeding thousands of images to this computer, developing algorithm either in the form of robots or softwares, and they are just giving decisions also. So there is a subset in artificial intelligence called machine learning, where the machine automatically learns with its experience, and this we can harness in form of decision making. So different DR analysis algorithms are available which work on image enhancement, the identification of interest region, then descriptor computation, and then DR classification. So this has definitely bridged the gap where we were lacking the graders or retina specialists or ophthalmologists. So this is doing the work on our behalf. Definitely we have to check it, but this can cut short our labor to a great extent. So we have also tried this smart screening at our center. So this is a handheld camera, and we are just trying to take images out of this. This time we don't allow the retina specialist to go to the camp, and this is being done by our residents with the help of hospital staffs. This is how the image of the retina is captured, and then it is analyzed with a software which is inbuilt, and it can indicate whether it's referable or you have to get under monitoring. Referable by diabetes mellitus means severe to moderate to severe NPDR to PDR with any amount of macular edema, that is sight-threatening. So if we want to print a report, it can instantly give a report also. We can give the report to the patient, and simultaneously he or she can be referred to a retina specialist. So this, by seeing the reports, the patient gets motivated also, and it's very useful for counseling part. So advantages are manifolds. It has increased awareness of diabetes and early referral, and ophthalmologists or retina specialists can give more chair time to the referable diabetic retinopathy. It can prevent complications, obviously, and it's a skill. So every skill is important. It is giving job opportunities to the society as well. So it has also been validated in different studies, and there is a published report that traditional healthcare system, while can serve one ophthalmologist can serve 4,000 persons per year. With integration of artificial intelligence, it increases tenfold. That is, one ophthalmologist can cater to 40,000 population. So it's remarkable. So to conclude, effective screening is desirable method, and fundus photography along with telemedicine can enable faster real-time screening, and portable digital imaging devices with integrated AI-based automated algorithms appear promising and can potentially reduce the burden on human graders. Thank you so much.